Hi, I want to talk about some of the side effects around this COVID-19 pandemic, and some observations, both good and bad. Uh, I think there's going to be a lot of things to say about this as time goes on. There's going to be new developments every day and new talking points. So, forgive me if the channel seems a little bit dominant on this right now because it is really the main thing to talk about. I will be discussing other subjects, but this is really on the forefront of everyone's mind. But I will bring up other things, maybe for a bit of escapism for people or something else for people to think about. Reading yesterday's Times, um, there's quite striking images they've got. Apparently, Londoners have been leaving the capital. Uh, this is wealthy Londoners who have second homes in the countryside, and that's created some tensions because people in the countryside feel that this is going to overwhelm their health services. I can understand that. Yeah, I can understand their frustration. I'll try and show you these photos. It's a little bit awkward because it's on two pages, but I'll try and show these. Yeah, a little bit hard to hold that straight, but basically that is from the Cairngorms of Scotland and also in Wales. It says Wales is closed. Go home, idiots. COVID-19. I don't want to exaggerate, but this is almost dystopian insofar as the social lockdown. Now, I don't want to exaggerate. We haven't seen tens of thousands of deaths. We haven't seen that sort of extreme situation yet. And I think it's my gut feeling is that's unlikely. I think at this point, the government's taken the right measures. You can argue it's too late, but I do think they've taken the right measures. And I did notice that there was a slight slowdown in the number of deaths from 420 yesterday to 465 today, whereas before it had been a jump of 90 deaths from 335 to 420. So if that indicates there is a slowdown, that's a good thing. Now, a lot of things I'm going to say in this video is speculation, and I want to emphasize that I don't want to be in the business of pushing conspiracy theories as facts. I think there's too much of that online. The rapper Cardi B was in hot water for her idiotic comments that celebrities were being paid to say they had coronavirus. And Idris Elba rightly called her out on that. It is troubling that you get these people with a lot of followers that just churn out, frankly, nonsense, and people take it at face value. We all need to think practically here. We need to be level headed and not buy into conspiracy theories, whilst at the same time taking it seriously. Um, But I was thinking of some of the possible side effects of this. Will it reduce crime? Well, that could go both ways. Certainly, the court system is going to be affected by this. I imagine a lot of trials are going to be held by video link. Juries are going to be out of the question. That's going to raise a lot of questions about due process. So this thing really affects everything, particularly with, for example, murder trials or rape trials. More serious crimes. But paradoxically, it could also reduce crime because even criminals, even offenders, they may not care about the rest of us, but they will care about themselves. Um, so it may be that certain crimes go down, but it also could be that other crimes go up, possibly looting, possibly anarchy on a small scale. I mean, there was that incident in the South Meads area of Bristol. I was disgusted by that. Some yobs decided to set fire to two Iceland delivery vehicles. Um, and I know that was reported in the Bristol Post and it caused a lot of anger locally. This is incredibly stupid. This was shortly after the Prime Minister's announcement. Whether that was resentment about the lockdown or whether that was something else, I don't know. But I think, particularly at this time, the book needs to be thrown at them. Anyone attacking the emergency services, anyone vandalizing supply chains like that, I say really they need to face harsh consequences. And I know that it's different circumstances, so everything is up in the air. But, even if it means punishing them after this is over, they need to be held to account for that because that is actually risking lives. As far as I'm concerned, that is tantamount to it's like drink driving. It's it's directly risking lives. So I really think there needs to be hard penalties for that. I was thinking about the possibility could this reduce armed conflict. All the world's major powers are certainly their priority now is this. So, for example, Russia could be refocusing its military capabilities into possibly the situation at home, i.e., diverting it from Syria. Um, Armed conflicts are ongoing. I mean, there was an atrocity yesterday. The Taliban killed 25 people in an attack at a Sikh temple. So conflicts haven't just stopped; they are ongoing, but they're certainly now a secondary news item. And that may mean that even combatants, because presumably whether they be government forces or insurgents, even Islamists, they may have, religious notions of what this is all about. But they will still want their fighters to be available. So presumably even religious fanatics won't want to see their fighters dying off from this rather than their martyrdom crusade or whatever it is. Um, So paradoxically, it could have a positive effect in reducing armed conflict. I don't think it will wipe it out, but I think it could reduce armed conflict. And maybe, just maybe, one can have a very, very, very glimmer of optimism that that may be actually a long-term thing. I think that's a bit utopian. Certainly, it's been, like I said before, and I don't think this can be understated. I think it's been had a very positive side effect for the environment. There's less pollution. We may even see species that were endangered, we may see their populations gradually increase again because there's presumably going to be less hunting, because even the hunters are going to be in social isolation, presumably. Although I have to say, in sub-Saharan Africa so far, the data would seem to indicate that they haven't had, thankfully, as many cases. And I say thankfully because in many of those countries, for example, Liberia, Sierra Leone, the healthcare systems are these are desperately poor countries that were already shackled by the effects of Ebola. And look at Haiti, which has its ongoing cholera epidemic, or Yemen for that matter. So these are countries that absolutely could not cope with this. Um, there may be side effects in terms of people maybe become more generous, more benevolent. On the other hand, people could become more selfish. So this could go either way. Um, I'm certainly abiding by the restrictions we have. Well, we have to. We'll be fined if we don't. But as it stands, we could still go out for exercise, for food, and I will do that. But I've even pondered on the idea of kind of a makeshift mask. I know that sounds a little bit out there, particularly as there's no evidence that masks make any difference. But if nothing else, to not to worry other people. Like if I go into a shop for milk or something, some one of the essentials, just to kind of show I'm taking it seriously. I'm a little concerned that people who genuinely are going out for the right reasons, as opposed to reckless reasons, might be stigmatized as being reckless. We have to understand that the government guidelines do allow for exercise, for food and medicine supplies, so people shouldn't be judged for that. However, idiots that are gathering together for a barbecue, as was the case yesterday, really, they are not only being reckless with themselves, they are directly fueling the spread of this thing. In the case of Italy, it remains the most affected country, but the good news there is it seems to be slowing down somewhat. As it stands, this is from Worldometer, which is a pretty reliable source, as it's from Johns Hopkins University. Italy has 74,386 cases, 7,503 deaths, 9,362 have recovered. Now, the data for the United Kingdom, I believe we're the seventh most impacted country as it stands, is 9,529 cases, 465 deaths, 135 recovered. and that is, as it stands, 6:07 a.m. on the 26th of March 2020. Spain has escalated badly. It's overtaken China now, and it might even surpass Italy. The United States is also increasing. So by no means is there a sign that it's slowing down around the world. There's localized situations where it's slowing down, but I mean, particularly thinking of India, a densely populated country of 1.3 billion people, I can see a real situation there. Um, because it's going to be very hard to enforce a lockdown in India when you have densely populated cities like Mumbai and Delhi and Chennai, Kolkata, Bangalore. It's I can really see, as it stands, India hasn't had that many cases, but I can see it really escalating. Um, and I don't want to be alarmist here. There is one theory, and again, this is very loose speculation. Don't take this as fact. Um, the Daily Mail reported yesterday that it is possible that half the country could be affected. Now, if that is true, that's a good thing because it means that the vast majority of people who are affected are experiencing only extremely mild symptoms or even no symptoms at all. It's a possibility. In other words, the people who are affected are having the worst symptoms. I still think context matters, and if we look at the UK, 9,529 cases is still a very low figure for a country of 60, almost 68 million people. I mean, that's like a small town. That's like the population of a small town. So if you look at it that way, the actual data would indicate that it's still extremely low. However, the social implications are very high because we're in lockdown, and I think that's the right decision. But it could well be that many more people are affected than is officially being reported. And I don't think that indicates a cover up. I think it just indicates that this is not an exact science. I mean, if we look at the 2009 flu pandemic, there's two figures which are drastically different for the death toll. One of them, as reported by the WHO, the World Health Organization, is just over 19,000, which is similar to the figure for this outbreak, which currently stands at 21,500. But unofficially, the toll could be anything from 175 to over 500,000 because of the data wasn't complete. So it may well be that many more people have got this disease and maybe many more people have died from it. To me, 21,000 still seems like a very low figure when we look at previous pandemics. So I think it's probably higher. But I don't want to be alarmist. That's just speculation. There's no evidence for that. I don't want to be, recklessly promoting conspiracy theories. Um, anyway, that's the latest for now. What side effects are you noticing? Any theories? I mean, any. I don't want to say theories because I don't want to encourage people promoting fake news. But what's your gut feeling? What do you sort of observe? What's the situation in your country? I'd be particularly interested in hearing from Italian viewers. What's your thoughts right now? But people, there is the good of humanity coming out of this. Two young people in New York City took it on themselves. I think they were called Invisible Hands. They were going around New York City, kind of delivering food to elderly people. So there is the good of humanity is definitely coming out of this, and that's a positive thing. Let me know your thoughts.